So as you know, the Olympics just wrapped and many of you cheered for your favorite athletes, even wondering if your child has the right stuff. Before they sign up for a competitive sport, make sure they get the right checkup. More than 350,000 people a year will experience cardiac arrest. Some of them are children, and we're seeing more cases since COVID. Here to talk about adolescent heart health and when there's cause for concern is Dr. Joshua Quinones with the Modern Heart and Vascular Institute. Hello there.
Good morning.
All right, interesting enough that we're seeing more cases among young people since COVID.
Yes, there had been an uptick. The virus seemed to attack the heart, and it was causing more concern among teenagers, yes.
Yeah, all right. Okay, heart attack versus cardiac arrest. A lot of times people use it interchangeably. They're not the same thing.
No, so cardiac arrest is more of an umbrella term. It can be due to structural or electrical issues, and that's what we see more common in pediatrics, whereas a heart attack would be a blockage of a coronary artery, what we think of more in the adult realm.
Yeah, all right. Cardiac arrest usually comes with no warning, which is why it kind of comes out of the blue. We see the headlines where this is this top, athlete, and all of a sudden a cardiac arrest brings them down.
Yes, so it can be quite sudden without any symptoms, as you said. There can be electrical issues that happen just super fast. Sometimes it can be inherited, but for those signs that you might see, it's good to pay attention to.
Yeah, who's susceptible?
If there's a strong family history, if there's anyone that you know of that you're related to that had a sudden attack such as that, or if you have a known cardiac defect like a murmur or a hole in your heart, it can increase the chances.
Which is one of the reasons why we suggest that if you have student athletes in particular, it can happen to anyone, but athletes in particular with exertion, that you come in and have a baseline and get checked.
Correct, yes, if there's any concern whatsoever, but athletes are exerting themselves and putting that pressure on their heart, and it can sometimes push you over the edge.
Yeah, if there are some warning symptoms, what are things to pay attention to that it might be your heart struggling?
So chest pain would be the typical one, but if you're having skipped heartbeats, palpitations, and of course, if your kid passes out with exertion, I'd hope most parents would investigate farther.
Yeah, all right. And then there's a preventative cardiology. Again, go ahead, come in, right?
Yeah.
At what age should you start, and at what symptoms should you bring someone in?
So a typical preventative cardiology visit would happen after a pediatric visit. Usually pediatricians will check cholesterol and blood pressure around the 10 to 12 mark, and if they have concerns, that's when they would come see a pediatric cardiologist to get that preventative education. A lot of the stuff that we all know and that's difficult to do, eating right, sleeping, and appropriitely exercising.
Yeah. Oftentimes we'll hear that someone has an issue and it was congenital, and you think that usually when something happens which means they're born with it,
yes,
that they would spot that when they're born, but there are some things that come to light later.
Yes, so sometimes the congenital heart disease that you're born with can be quite mild, and the symptoms can be things like slight blueness, difficulty gaining weight, or if you're on the smaller end of the growth curve, or just not being able to keep up with peers on a consistent basis, could all be clues that should warrant further investigation.
Yeah, it's interesting. How much of it is, you mentioned what runs in the family versus things that just happen. I think sometimes we have a tendency to dismiss, it doesn't run in my family, so I don't have to worry about that. So we dismiss something, but there is a correlation, but not always.
Correct. So strong family history, or a family history regardless, can be indicative of something that you might also have, but it can pop out of the blue. So for the parents out there, if they notice their kid is a little off, that intuition that they have, they should follow up on that.
Yeah, all right. Modern Heart is very active in the community, and part of your goal is to make sure people are aware. So there's lots of things you do to normalize talking about it. Yeah. When kids come to the doctor, come to the doctor, then that relationship is not one that's done out of fear, but one done out of being a partner in their own health.
Correct. So some of my patients, I tell them, if they're not taking their medicine, just let me know. We are here to take care of your heart for the future. You're not going to be in trouble.
Yeah.
Your parents, myself, we're a care team trying to make sure that you're going to be safe.
We were talking about before the show, we said, I go, what do you like working with more, the kids or the adults? You go, the kids are a little easier to work with.
Absolutely, yeah. I would go pediatrics every single time.
Yeah, all right. And with that said, Modern Heart and Vascular treats all ages. So you literally in your office can see a child, but you can see grandma or great grandma and grandpa in there as well.
Absolutely, yes.
Yeah. And then of course there's the vascular side, because sometimes people don't make the connection. They think heart and veins are two different things. It's related, but what's great about y'all's practice is that you all have specialists in every field. So if there's a vascular issue, you can treat that as well.
Correct. So we have structural specialists, electrical specialists, and vein specialists. So any age, any concern about the heart or veins.
Yeah, yeah.
Absolutely.
All right, so I started earlier by saying that the Olympics have wrapped up, and it happens every time, every 4 years. I remember as a kid, I would go out in the front yard and do cartwheels and go, I'm really a gymnast, right? So we were also talking about before this show started, if you could be an Olympic athlete, what would your event be?
I think I'd have to go with decathlon, just all-around athlete.
Yeah, talk about challenging the heart.
Yeah, absolutely.
That'll get your heart rate up.
Yes.
All right.
10 events in 2 days.
Wow. All right. Thank you very much.
Yes.
Okay. Modern Heart and Vascular Institute is seeing patients of all ages, as we mentioned, kids, parents, grandparents, and great-grands if you got them. To book an appointment with a board-certified cardiologist, visit them online at modernheartandvascular.com. You can also give them a call at this number, 832-644-8930. Again, that's 832-644-8930.